Welcome aboard, guys. And sorry for the delay in this. There has been a ton of technical difficulties, but I think we should be well on our way now. So hopefully this is working. If not, please let me know and we'll get it fixed. But I think we should be good now. Wanted to welcome you guys. For those who have never taken me before, I am Dross, Professor Dross, Ms. Dross, I don't care. There's just a lot of Kristens in my department, so I tend to answer to Dross more than anything else. A few things about this course before we get started. It is an online course, so unfortunately for you guys, that means you're gonna have to actually read the book. I know, it's painful. Which book, you may be asking? This one. With the orange. My department chair got with me earlier in the week and said that the bookstore may have been giving out the wrong one. If that's the case, please contact me and let me know. But hopefully this is the book that you have. You will also be needing online access for your quizzes because all of your quizzes will be online as the rest of this class is. To let you know how I do things. First off, the quizzes, like I said, are online. You can take them as many times as you need to. That is, the questions on the quizzes will be infinitely harder than what you see on the test. So if you are passing the quizzes with no problem, the tests should probably come pretty easy to you as well. And the way that I get all of my material is through the book. I do exactly what you guys have to do, where I sit down and I read the book and I pick out what's important and I put it in the PowerPoints. And to make sure that you're reading along and that you're comprehending and so that you know what to look for, there are blanks in the PowerPoints that you go through and fill in. So hopefully that system's working for you. And if you have any questions on it, let me know. What I am going to do right now is pick up the PowerPoint and go through it along with the book really quick. Periodically, I will also be telling you what page of the book we are on. So that should be helpful as well. Any questions, email me, let me know. Canvas also has a nifty little chat feature, so feel free to try that out. If I'm online, feel free to ask questions. But without further ado and without any more technical difficulties, here we go. Thank you guys for being eager and being on top of it and being responsible. Normally this will be going up probably Tuesday or Wednesday. You should not be seeing this come up on a Thursday again. So hopefully that'll help speed things up as well. So beginning from the beginning, defining psychology. Psychology is the study of behavior and mental processes. With this definition, I need you to understand that it is twofold. Behavior are things that are observable, or behavior is something that is observable. It is actions. It is things that you can actually see happening. So it's not me thinking about things or remembering things. It is what you can actually see me doing. So right now you see me talking, you see me gesturing, you see me sitting. You can observe me doing all of those things. You have no idea what I'm thinking or what I'm feeling. I mean, yeah, you can kind of look at my face and surmise, but you don't know for 100%. And that's where the mental processes come in. Thoughts, attitudes, feelings, things like that, things that you cannot observe. So, simply put, psychology is the study of behavior, so the things that people do, and the mental processes, so why they do the things that they do, the things that they think while they're doing these things. So one of the things in the quiz is it asks what is an example of a behavior. Behavior is everything that we do and that can be observed. So kind of keep that in mind. On this quiz, I think your options are thinking, remembering, and forgetting, I think. The actual behavior is driving, because we see people driving all the time, right? In cars, on the road. You know that's what they're doing. You don't know what they're thinking or feeling while they're driving them. Psychology is a science. This is why we are housed in the history and social science department, because we are a science, we are a social science. But more importantly, we are a science because we use the scientific method. We have a systematic way of researching things, asking questions, evaluating things, and that method is the same whether you are looking at psychology, so study of behavior and mental processes, Or if you're looking at biology, chemistry, physicists, we all use the scientific method. That's something that we have in common. And that's going to be a lot of what chapter 2 is, so prepare for that. But that is why we do the things that we do. So continuing on with behavior and mental processes, in the PowerPoint I use an example of sadness and crying. Sadness would be the mental process or the feeling. Crying would be the behavior, because you can see someone crying. People cry for multiple reasons. Sometimes people cry because they're happy. Sometimes people cry because they're in pain. Sometimes people cry just because they're feeling emotional. Crying does not always mean sadness. So that is kind of the proof that the behavior you know for 100%. The mental processes, the feelings and attitudes behind it, you're not always going to know the answer to. And that's where psychology comes in. Okay? So empirical method. Empirical method is something that goes along with that as well. Empiricism means it's something that can be observed with one of your 5 senses. It's things that you can see, things that you can hear. Maybe you smell them, maybe you touch them, maybe you taste them. It can be observed with the senses, and that's what empiricism is. And that is also what makes psychology a science, because empiricism and the empirical method is what allows us to gather data. And it's that data observation and collection point within the scientific method. Critical thinking. You're going to have to do a lot of critical thinking. And you may be surprised to learn that you've already done it. It is thinking deeply and reflecting on something. It is using logic to ask questions and make inferences. So you're going to be doing a lot of it in this class. You already do a lot of it. So one of the things in the quiz also is there's a situation where it asks about skepticism, and there's a girl named Lindsay who has been giving a sleeping medication. Critical thinking is, okay, Lindsay's not sleeping well. What could be causing it? Maybe it's insomnia, maybe it's stress, maybe whatever it is. So Lindsay goes and she gets these sleeping pills, and she notices that she starts sleeping better. Well, critical thinking is what comes with skepticism. Is she sleeping better because of the pills? Is she sleeping better? Maybe she got a lavender air freshener and that's helping her sleep better. Maybe she got a new roommate and her new roommate isn't as noisy. So maybe it wasn't the pills, maybe it's the new roommate. You don't know. But you aren't going to know these things if you don't think critically and ask yourself. So that's why critical thinking is so important. And in this class, it's going to be important too, because I'm not going to see you guys' faces. I'm not going to be able to read the crowd and be like, hey, they really get this, or no, what, huh? Like, I'm not going to have that opportunity. So this is one of those things where you need to be asking yourself critically, do I really understand this concept, or do I need help? So keep that in mind throughout the course of the term as well. Applying critical thinking to science. So we kind of already gave an example of that with Lindsay and her sleeping pills. Think about this too, and this is it's applying it to science, but it's also applying it to everyday life. Maybe you have a friend, Kelly. Kelly's lost 20 pounds, and everyone's like, good for you, I'm so happy for you, because that's what our culture does, right? We're going to talk about sociocultural psychology here in a little bit. In our culture, whenever people lose weight, we tend to congratulate them. Because we think that everybody is trying to lose weight, but that's not necessarily the case. Sometimes you lose weight for good reasons. Maybe you're trying to improve your overall physique. Maybe you're trying to improve diet and get more exercise. Those are good, healthy causes of weight loss. But that's not always the case. And maybe this is something to think about before you are in this situation again. Maybe Kelly's not trying to lose weight. Maybe Kelly's depressed. Because that is one of the signs and symptoms of depression, is decreased appetite. Maybe it is stress or illness. Maybe Kelly has cancer and you didn't know, and that's why she's losing all that weight, because she's undergoing chemo. It's going to feel really painful whenever you say, oh, look at you, good for you, you lost weight. And, she turns around, yeah, because I had chemo, thanks. So think critically and think about what you say and how you do things, because sometimes that critical thinking will spare you an embarrassing or aversive situation. So that's something to keep in mind as well. Going through also, right now we are on page want to talk to you really quick about positive psychology. And I want to clarify something. I want to clarify the difference between positive psychology and humanistic approach. Why do I want to do that? Because there is a common word within each, which is optimism. With positive psychology, first off, this is associated with Seligman and Lazarus, and these guys have been doing a really good job of this. They look at the positive traits of humans. Clinical psychology tends to look at when people are disturbed, whenever they're depressed or anxious, something like that. Positive psychology it looks at good things. It looks at resilience. It looks at camaraderie and affiliation and altruism. Altruism is helping behavior. So this is looking at all of the good things about human beings. And yes, that is a more optimistic view of psychology. However, we're looking at that within its own separate field. Humanistic psychology, or the humanistic approach, is individual. And we're going to talk a little bit more about this here in a little bit, but it is the belief that your clients or your patients, that they're their own experts, that they have all the answers to all their own questions, and it's just your job to help them figure those things out. They control their own destiny, and they already know what they need to be doing with your life. It's just your job to help guide them along. But both of these are very optimistic viewpoints. I just wanted to go ahead and emphasize that positive psychology is a field looking at lots of studies, whereas with the humanistic approach, you're talking about one kind of therapeutic intervention that is applied on a one-on-one basis. But both of these emphasize the goodness of human beings, their positive qualities. So I wanted to go ahead and make that distinction to kind of clear that up. Going back to the empirical method, talking about Wundt. I know it's a W, but it sounds like a V, Wundt, and William James. So William Wundt is the father of structuralism. He is concerned with how the brain is made up, the basic elements and structures of the brain and mental processes, and things like that. He looks at it in a very basic kind of component view. Whereas William James is the father of functionalism. I'm going to tell you right now, for assessment purposes, no William James. He's a big deal. And, one of the things that kind of goes along with that is you'll hear William James' name not only in psychology, but if you take any philosophy courses, any religion courses, William James is very focused on introspection. Because whenever we look at these mental processes that underlie our behavior, introspection is how we do that. So going back to crying, that's a behavioral expression. It is a therapist's job or counselor's job, or maybe a friend's, depending, to talk to that person and ask, hey, what's going on? Why are you crying? And at that point, that person's going to perform introspection, and they're going to talk about what's bothering them, and tell you, oh, it's because my dog died, or whatever the sad story may be. Or maybe it's, my best friend just got married and, I'm so happy to see them and yay. Maybe it's happy crying. But you don't know that if the person doesn't perform introspection and tell you what's going on. So that is where William James comes in, and that's where he focuses on the purpose of the mind, its function. And that goes along a lot with those mental processes. So hopefully that's some clarification and some distinction. Carrying on page 9, not really going to talk about it too much right now. We are going to talk about it more a little bit later. Darwin and natural selection. This is huge whenever it comes to evolutionary psychology, which we'll talk about here in just a minute. It is basically this idea that there are certain attributes and features and characteristics that improves one's organism's chances of survival. So things that will give you an evolutionary advantage and increase your likelihood of surviving, and also increasing your likelihood to keep the species going and to be able to produce offspring to keep the genetic line going. So that natural selection are those traits that give an evolutionary advantage. For example, like a camel. Unlike a lot of other animals who live in the desert, camels have an evolutionary advantage. They have a hump, sometimes they have 2 humps to store water. That's something that helps them survive their environment. That's also an example of natural selection. So carrying on from there, that is going to lead us to, I'm going to skip along to page 11, talking about the biological approach. This is a psychological approach. It focuses on the body and the mind and your nervous system. So how your brain affects your body and how your body affects your brain. One of the things that's huge in psychology is nature versus nurture. And the biological perspective gives a lot of analysis on this because it looks at genetics and it looks at things like that to describe, hey, how much of this is a product of biology and this human DNA, things like that, and how much of this is the environment around them causing what we're seeing. Now with neuroscience. Definition of this: the scientific study of structure, function, biochemistry of the nervous system, focusing on brain and nervous system. This is the word that I want to trigger you, okay? Whenever you hear biochemistry, think of neuroscience, okay? That's going to be your big indicator. Because what you're looking at is the brain and how certain glands will trigger certain hormones and cause certain reactions. And that's the biochemical part of this. That is the biochemistry where, oh, hey, the thyroid gland or the thyroid released this, causing this to happen, or the pituitary gland triggered growth at this time and, caused this to happen. That's all part of neuroscience, okay? Now, this next part is really important. We talked a little bit about the difference between behavior and mental processes. What I need you to understand is why behaviors are so important, because we're going to talk about behaviorism. Behaviorism is not necessarily concerned with the thoughts and mental processes, feelings, attitudes, etc. What they are looking at specifically is the behavior and when does this behavior occur, in what environment does this behavior occur. So by definition, a psychological approach on focusing on the study of observable behavior responses and environmental determinants is behaviorism. One of the quiz questions talks about a doctor who wants to get a little girl to clean her room. So how does he do that? He gives her a $10 bill. Doesn't ask her what she's going to spend it on, doesn't ask her if she's going to put it in her piggy bank. He's not concerned with that. What he does know is that $10 bill will get her to clean her room, and that's what he's concerned with. Also going along with this, school psychology. So maybe you have a student who is not doing well in class, maybe they act out. A behaviorist will go observe this behavior in the classroom, and a behaviorist may notice that, well, it happens more around 10:30 or so. Okay, well, when does the child eat breakfast? Maybe the child's hungry. But what the behavior is concerned with is, what is that behavior? When does it happen? Beyond that, it is normally somebody with a different theoretical orientation that is going to surmise the kind of thoughts, feelings, and attitudes behind that. So with behaviorists, they are simply concerned with defining the behavior, observing the behavior, and recording it. They're not going to ask, well, what were you thinking or what were you feeling whenever you did this? That's not what a behaviorist does. And actually, there's a true-false question also on the quiz about that it's behaviorists are concerned with thoughts and feelings. Not so. They are not. Behaviorists specifically observe and record the behavior. So keep that in mind. Now, the next thing that I need you to know and understand, I want you to tie some words together. Unconscious and Freud. Whenever you hear those things, think of psychodynamic theory or psychoanalysis, okay? When you hear Freud, you should automatically associate that with psychodynamic or psychoanalytic, okay? And unconscious, it goes right along with that. So this approach focuses on unconscious thoughts and conflicts between biological drives. Freud is associated with that theory. That is psychodynamic or psychoanalytic, okay? What he is saying is that there are things that happen in your mind that you are not aware of, and it will cause you to act a certain way. We're going to talk a lot more about it in future chapters. The personality chapter is really big with a lot of Freud's theories. And this is something that I want you to keep in mind. Freud is huge in our field, and there's a reason for that. He brought a lot of notoriety, a lot of popularity to the field. His scientific methodology, kind of faulty. A lot of his morals, kind of faulty. But he did a lot as far as notoriety and popularity in the field, and psychology definitely wouldn't be where it is without him. So that's something to keep in mind as we talk about these things. Going on, talking about approach. So again, this is blank approach, focusing on people's positive qualities and an emphasis on growth and control of their own destiny. That is the humanistic approach. That is that people are overwhelming or typically good, and that they can grow to be better people, and that ultimately they decide what they want to do with their life. And that's the humanistic approach. Carl Rogers is famous for this. One of the things that I am going to do is also post a video of Carl Rogers in session with his client Gloria. One of the things that you're going to see in that video is that Gloria, he comes in, he meets her, she says things. A lot of what he does is saying, oh, so I hear you saying this is a problem. And you're like, this dude gets paid how much to say this? All he did was repeat back what she said. Or he may go, wow, that is a really interesting problem. I see how that can cause a lot of problems for you. That's challenging. And you're like, seriously? This is what this guy gets paid to do? Yes, he does. Because for him, it is not that Carl Rogers has all the answers. It is that his client has all the answers. And the way that he brings those answers out is providing her a safe space where she's comfortable and can explore her own thoughts and feelings to come across with that answer. And that's what humanistic approach does. The next one, talking about cognitive approach. Again, words that should kind of throw light bulbs off in your head: memory, attention, problem solving, and critical thinking. A lot of times cognitive psychologists are looking at, of course we know memory declines with age. Cognitive psychologists are the ones to tell us these things. They look at how does sleep deprivation affect attention. One of the cool things that they have is a driving simulator that is more difficult than usual because it's supposed to act as if you are sleep deprived driving. And that's one of the really cool things about cognitive psychology. But they're looking at memory, attention, problem solving, things like that. So the next approach is talking about adaptation and natural selection. Again, natural selection, go ahead and associate that with Darwin and associate that with evolutionary psychology. All of these things go together. Focuses on ideas like adaptation, reproduction, natural selection. Go ahead and tie those words with Darwin, because those are his theories, and that's what evolutionary psychology is based off of. What improves your chances of survival, and what helps you keep the genetic line going. So from an evolutionary psychology standpoint, one of the things that they look at is selecting a mate. There are certain things that cultures find attractive because it increases the likelihood of the person being able to procreate. An example of this is big hips in women. There's an evolutionary psychological reason for that being a popular trait in attracting a mate. And it's because larger hips are indicative of healthy childbirth. And again, this is all having to do with increasing our chances of survival, not only as an individual, but as a society and as a species. How social and cultural environments influence behavior. This is going back to the socio-cultural approach. And what we're talking about is how does society and how does culture influence the way people think and behave. One of the questions on the test is it mentions religion and comparing people of two different religions and the differences between those people. How does a person's behavior change according to their society? So for example, in Western cultures, a lot of times we tend to use external attributions and be like, oh, well, yeah, I did poorly on this test because, so-and-so made me go out with them, then I should have spent more time studying, but instead I went out with my friend because it was their going away party. So instead of saying, yeah, that was me, and taking responsibility for our own actions, we tend to a lot of times use external attributions. Whereas in more Eastern cultures, if someone does not do well on a test, they say, I should have worked harder. I'm gonna do better, and I'm gonna do this again. I'm gonna study more, and I'm gonna get a better grade on the next one. And that's all part of our society and part of our culture. And that's where sociocultural psychology comes in. So physiological psychology, talking about the body, and behavioral neuroscience, how the mind and the body influence each other. Sensation and perception, a huge thing with sensation and perception. Sensation is detecting stimuli. So right now you're hearing my voice, which may or may not be pleasant. Either way, I apologize if it's not. But sensation is hearing that. Thinking about what I'm saying, what these words mean, putting these terms into a mental foundation that you understand, that's perception. So think about it in terms of a piece of candy. I give you a piece of candy, you pop it in your mouth, and you taste it. That is sensation, okay? Whenever you go, oh my God, that's a warhead. That is so sour. That is perception. That is how you understand it. And you know, okay, I have this concept of sour, and that's what this candy is. Oh my gosh. Versus sensation, which is just detecting that you put something in your mouth. So that's kind of the difference between the two. Learning is something that happens every day. For terms of learning, I don't want you to think of it as necessarily going to a classroom and doing math or something like that. Learning happens all the time, every day. Being able to read someone's face and be like, hey, how's your girlfriend doing? And then them saying, you're like, oh, I probably shouldn't have mentioned that. They probably broke up. That's an example of social learning. And that's something that takes place as well. And learning, be it in a classroom or social learning, whatever it is something that psychologists like to study, and it's very popular. Cognitive psychology, again, going back, the kind of keywords that should come up with that, memory, attention, thinking, all of these things have to do with cognitive psychology. Developmental psychology is looking at psychology throughout the ages. So not like ages within a person. So babies cry. Why do babies cry? You're like, maybe they have a wet diaper, maybe they need to be fed, blah, blah, blah. Yes, this is all true. They are trying to get a need met. Developmental psychology tells us that that is how children get our attention. Around the age 1.5, 2, they start using words. Developmental psychologists say, hey, this is about the time that they're supposed to start speaking, and they start looking at how many words they can use, the type of words that they can use, things like that, to try and encourage that development of use your words instead of crying. It's probably a really popular term with some parents. You see a lot of people use it. Use your words. Use your words. That is because from a developmental psychology standpoint, you are trying to teach them how to communicate with others in order to get their needs met. And as things go on, say for example that you have an adolescent who has anger management issues and is punching through walls. From a developmental psychology perspective, you're going to look at that person and go, okay, what happened in this person's life that they aren't using their words to communicate their anger and that they are physically expressing it? Was it something with, did something happen during their formative years where they're supposed to be learning their words and they didn't learn their words right, or emotion takes over? Is it improper attachment? All of these things have to do with developmental psychology. Motivation and emotion, that is very popular, especially here in the States, because you look at, for example, say weight loss. What is going to motivate people to lose weight? When do you do certain things? One of the things right now that's popular with Pinterest and stuff like that is bullet journaling. And there's something on there called habit tracking. And that's for people who maybe find themselves engaging in habits that they don't like. Motivation and emotion is something that psychologists study to help minimize those habits that we don't like. So, psychology of women and gender, that is a particular subset of psychology that looks specifically at women and the gender, looks at how women have changed throughout the time of women's suffrage, women's rights, things like that. Focuses specifically on that. Personality psychology. We're going to talk a lot more about this whenever we get to the chapter on personality. For now, what I want you to understand is that personality is a relatively enduring set of traits. Haven't really gotten to meet you guys one-on-one, but hopefully you're getting a sense of my personality. I tend to be laid back. I tend to be very kind of take things as they come, very chill, until I can't be anymore. And, whenever that comes, it's a really difficult time for me because that's my personality. But, I have had cases where people cannot get their act together and I have to micromanage them. And I'm like, I need you to do this now. I need you to do this. Why aren't you doing this? What is wrong? That is counter to my personality because that is a relatively set of enduring traits. I've always been kind of go with the flow. So, personality, enduring traits. Social psychology is one of my favorites. Social psychology, we're going to talk about that. Milgram and Zimbardo. So talking about shock experiments and obedience and persuasion. This also has to do a lot with discrimination and prejudice, things like that. We are looking at people as social beings. And whenever being in this social situation, what is the behavior that we can expect? Industrial organizational psychology. It's a lot to do with business. Say, for example, that you are opening a new restaurant and you say, hey, what color wall is going to make people come into my restaurant and order more food? That's something an industrial organizational psychologist would tell you. They're very big on improving business practices, attracting customers, things like that. Maybe if you bought a new car recently, that whole thing wherever you come into a showroom and people, hey, have you been helped? Can I get you some water? Can I get you some coffee? Here, have some snacks. That's all part of industrial organizational psychology. You're coming in and they know that you're going to be dropping 20 grand or however much on a new car. They want to make you feel important in hopes that you spend your money there. Again, that's an effective industrial organizational psychology. Clinical and counseling psychology. Whenever people think of psychology, this is what they tend to think of. Again, clinical psychology is kind of looking at when things go wrong. Counseling psychology tends to be a little less severe. So with clinical psychology, you're going to be looking at people who may have schizophrenia or major depression or anxiety. Clinical psychology tends to look at more lifelong pervasive conditions, whereas counseling may be less severe, not quite as problematic. Maybe mom and dad are getting a divorce and the child is not dealing well with it. They may put them in counseling. It's not going to be a lifelong thing that they keep going to all their life. It is just to teach them coping mechanisms and things like that to help them deal with that immediate stressor. Whereas clinical counseling is going to be pretty enduring. It's going to be something that most likely keeps going because of the level of severity of illness. Health psychology, looking at your brain and how it affects your body and how it affects your brain. This is also going to be looking at things like cancer. So what are rates of depression like in people with cancer, both terminal and non-terminal? There are going to be studies looking at that. Another one, something that you may not know, people with depression are a lot more likely to have cardiovascular issues. And health psychology looks at those statistics and those trends and those phenomenon and explore those things. Community psychology, you're looking at how to improve communities and get people to be more proactive and participate in them, and in what's best for them. School and educational psychology, this is your go-to. These are the people that are in schools with your kids and will be performing assessments for ADHD and learning disabilities and things like that. So a lot of times that'll be kind of your front line or your first exposure to autism or speech issues, things like that. Environmental psychology is looking at how the environment affects your mental health. Forensic psychology, a lot of times you're going to be looking at, is this person competent to stand trial? Are they psychologically fit? Are they competent? A lot of times too, these will be people that go into prisons and perform assessments or counseling with people who have performed crimes. Forensic crime psychology. Put those two together. Sports psychology. This has a lot to do with performance. Not only necessarily athletic, but also test anxiety, things like that. Looks at performance and actually how a little bit of anxiety can improve performance, but too much can hinder. These are all kind of principles within sports psychology. And then cross-cultural psychology is looking at different cultures and how different cultures have different psychological effects. So that's just kind of a broad overview for testing purposes. It's probably not going to be that extensive. You'll kind of get a feel with the quizzes as far as what's going to be major assessment and what's less likely to be focused on. So that being said, let's move on to the quiz, shall we? So you're going to see a lot of these things are repeated. If I bring it up more than once, you're probably going to see it on the test. So go ahead and use that to help you prepare. Psychology, formally defined as study of behavior and mental processes, right? And behavior being the things that you can observe, mental processes being thoughts, feelings, things like that you cannot. Which of the following is an example of behavior? A man imagines, a student remembers, an old man forgets, a woman driving. That you can actually see. You don't know whenever you see a man if he's remembering something or forgetting something. You have to guess at that. But if you see a woman driving, you know for 100% that that's what she's doing. So according to the science of psychology, a behavior is something that can be directly observed, something that you see and you know is happening. You don't have to guess about that. Blank is the process of reflecting deeply and actively, asking questions and evaluating evidence. Again, this is critical thinking. Whenever Lindsay starts sleeping better, is it because of the sleeping pills, or is it because she got a new roommate, or she moved, or a new air freshener, whatever? That's what critical thinking does. It helps you kind of rule out those other areas, so to foster skepticism and know for sure that what you're seeing is the effect of what you think it is. So, which of the following statements best defines critical thinking in psychology? Again, literally, verbatim the definition, reflecting deeply, asking questions, and evaluating evidence. How do we know that this is what we really think it is? You got to ask yourself that question, and you got to prove it to yourself. That is scientific rigor. Lindsay, again with the sleeping pills, which of the following scenarios demonstrates the attitude of skepticism in psychology? Martina asked her pharmacist to repeat the instructions. That's not necessarily indicative of skepticism. She is not questioning what the pharmacist knows. She just didn't get the information, so she's asking them to repeat. Doug tells a customer at his clothing boutique that she can buy clothes cheaper at another store. Again, you are not questioning what he knows. He's just telling you this is what he knows. You are not questioning what he knows. That's what the skepticism part is. Lindsay wondering if the sleeping pill will work and can really help her sleep. That is skepticism, because she's like, maybe this will work, maybe it won't, I don't know. So, obviously answer to that one. Being skeptical, question everything. Watch X-Files if you need to, whatever. Ask questions, because scientists are okay with being wrong. We actually kind of like it when that happens, because that may make our temporary theories look bad, but it leads to more research. So question everything. Why are things the way that they are? Because asking questions like that, if you really want to know the answer, you shouldn't be defensive when people ask the question. If you're really that sure that this is what you're seeing and this is why this is the way that it is, then you're not going to be scared when somebody asks you why. Gaining knowledge through the observation of events, collection of data, and logical reasoning. This is all empirical method. This is based off of things that you can see, collecting data, and using logic of why this happens. The big one, and what I really want to be the key word of that, is observation of events. If it is empirical, it is observable. William James, remember, he's functionalist. He's concerned with why people have the thoughts and feelings that they do. Whereas William Wundt was more about structuralism and the components of mental processes. Charles Darwin argued that blank determines which species wins the competition for scarce resources. This is where natural selection comes in. Remember the Campbell example? It lets them keep water. Water is a scarce resource. So that's kind of how these things work. And that's all natural selection. It helps them survive their environment. So, describing the process of natural selection, Charles Darwin claimed that organisms that are best adapted to their environment will survive and produce offspring. That is what natural selection does. It helps you survive, and it helps you keep the genetic pool going. So, question 12, key word here is biochemistry. Studying the structure, function, development, genetics, and biochemistry of the nervous system. I want you to associate that with neuroscience. So whenever you see biochemistry, think of neuroscience. Think about your brain secreting hormones and changing the chemistry in your body, because that's what it is. Now, the blank approach to psychology emphasizes the scientific study of observable responses and their environmental determinants. Again, you are not concerned about mental processes, thoughts, or feelings. What you are concerned about is the behavior. And that is the behaviorist perspective, or the behavioral approach, rather. Timothy is a behavioral psychologist. We talked about this a little bit ago. He knows that giving that little girl $10 to clean her room will get that room clean. He doesn't care why she wants it. He doesn't ask her what she's doing with it. He just knows that that will cause the behavior, and that's what he wants. So, let's see. Eve, 5-year-old girl who has been brought to Dr. Frost for therapy because all of a sudden she stopped speaking. She answers no questions, communicates with no one. Dr. Frost uses techniques intended to uncover Eva's unconscious thoughts or experiences. Again, go back to what I said. Unconscious thoughts, think Freud, and think psychodynamic or psychoanalytic. Okay? And that's exactly what this one is. Eva, Dr. Frost is treating her from a psychodynamic perspective, looking at her unconscious thoughts and motivations and conflicts. Which of the following is true of the practitioners of psychodynamic approach? This goes back to Freud. So one of the criticisms of Freud is that he is too hung up on sex and aggression. I told you Freud did a lot for our field, brought a lot of notoriety to the field. But that is one criticism of his perspective, is that everything is about sex and aggression, and that sometimes it's not always about that. And that's one of the major criticisms of his approach. So, which of the following is true practitioners of psychodynamic approach? That they believe sexual and aggressive impulses buried deep within the unconscious mind influence the way people think. Whenever we get to psychology and Freud, we're going to talk about the Oedipus complex, and you're going to see exactly why people say this about him, because, this is kind of an uncomfortable thing to talk about. Freud kind of hypothesized that children were sexually attracted to the opposite sex parent, and it's like, who wants to believe that? Who wants to think about that? But, again, this is not something that's conscious, not something that people are aware of. He thinks that it's something that happens in the unconscious mind, and that people don't realize that this is happening. In psychotherapeutic practice, Dr. Wagner stresses his client's unconscious processes. Again, unconscious, psychodynamic, or psychoanalytic, whatever your options are. Okay? And no, I'm never going to be that person that I put psychodynamic and psychoanalytic, on a multiple choice question test, and I'm be like, oh, you got it wrong because you put psychodynamic. That's not how I operate, guys. Just because to a lot of people, those terms are interchangeable. So, but unconscious, psychodynamic, psychoanalytic, Freud. Okay. According to the blank approach to psychology, a person is in control of his or her own life and has a capacity for positive growth. Again, this is the humanistic perspective, that people are essentially good and want to grow and become better people, and master of my fate, captain of my soul, Invictus, by the way. I'm a big poetry person, so You may or may not know that, but that is one thing that humanism and humanistic approach focuses on, is being able to determine your own fate. Which of the following psychological approaches on the mental processes involved in knowing how we direct our attention, perceive, remember, think, and solve problems? Again, you're talking about attention, you were talking about perception, you were talking about memory. All of these things should be triggering you for the cognitive approach. That is what cognitive does. Okay? So cognitive, think attention, think memory, things like that. If a psychologist studies about the behavioral differences between people from two religions, he or she is most likely following the socio-cultural approach. Again, kind of the difference between approach and specialization. I'm not going to get that specific with it. This is as specific as I'm going to get, and it specifically says religion, so because of that, it's going to be part of society and part of culture. So I'm not getting that nitpicky as far as assessment goes. So, and the only reason why you get it on the quiz is because these quizzes are going to be, again, infinitely more challenging than any test that you have come your way. So if you can answer these confidently, the test should be no problem. Blank is the broad name given to the field of psychology that specifically examines attention, consciousness, information processing, and memory. Again, your keywords are attention and memory. You should be jumping to cognitive psychology for that. Which of the following is true about nature-nurture controversy in psychology? We talked about that a little bit. That is big with biological approach. What you need to know is that it's almost never all genes and it's almost never all environment. It is how they react in the interaction of those things. So both nature and nurture play significant roles in the psychology of a person. I look a lot like my mom. I kind of sound like my mom. We have a lot of the same mannerisms, but we're also different. And the ways that we are different is both genetic and environmental. We did not grow up the same way. In addition, I also have an extra, set of chromosomes from my father that make me different than her as well. So you can't pin the differences on just one or the other. It is a combination thereof. Neuroscience emphasizes the brain and nervous system, that the brain and nervous system are central to understanding behavior, thought, and emotion. That is true. But a lot of people think the brain and the nervous system are central to understanding and behavior, thoughts, and emotion. That's all true. Behavioral approach to psychology focuses on thoughts or feelings that influence the way people behave. No, that is false. Okay, remember, behaviorists are only concerned with what the behavior is, defining it, observing it. They are not concerned with why people think or do the things that they do. All they do is observe the behavior. And then last but not least, the psychodynamic approach to psychology contends that there are many unconscious determinants of behavior. True. Again, psychodynamic, psychoanalytic, unconscious, those things should already be associated in your mind. So, with that being said, hopefully this is the last time that I have to do this. I apologize for the delay again. Let me know whenever you watch the video what you think, if there's something that you need me to cover more in depth. That is something that we can discuss on discussion boards, or I can post an additional video, whatever we need to do. But hopefully that pretty much sums everything up, and hopefully that got you a better feel for the class and as far as what to expect. For the writing assignment, you will be getting more detailed instruction probably within the next week, maybe two. It's not going to be anything difficult. What you're going to be doing is you're going to be looking at some of the resources that I provide online as far as videos, links, studies, stuff like that, and you're going to be evaluating those things critically. That's really the worst of it. That is pretty much what to expect. So hopefully this helps you get a better understanding and puts you a little bit at ease. Let me know what you need. Let me know what questions you have. In the meantime, I'll see you later.